This is one of the best ways to prepare for surgery. So while you're there waiting and having all these anxieties of like, what's gonna happen? Am I gonna be able to do what I want? And if not, how long is it gonna take me to get back on your feet? This little tip that I'm gonna share with you is gonna help take the edge off of all those things running through your head right now. So think about this for a minute. Who gives you information about what's going to happen after your surgery? Your physician? You got it. So typically he or she is coming from a medical background. So you'll hear a lot of medical things like look for these signs of infection or fever. I'll see you this many days after surgery, or, we're probably going to put you on this pain medication. The second person that you typically get information from is the nurse. But in the pre-op stage, typically they're very focused on preparing for surgery. Don't eat after midnight, wash with this type of soap, be here at this time, all of those things. And sometimes they may give you some recommendations on what to do afterwards, but typically it's some of those things that they just read in a nursing book. And while all of this isn't bad, it's all great, but it's the fact is none of that translates into what you have to do with your life task after surgery. And in my opinion, that is just the bare minimum. And we're not here for bare minimums. We want to get the most information we can to prepare for a successful recovery. So to make sure that you thrive, not just survive after surgery, what you need to do is identify that healthcare professional that fields the questions and the calls from the patients after they go home after surgery. So this is the individual who talks to patients in the first 48 hours who say, oh, I'm so weak and miserable and tired from these pain medications. Hey, that's a good data point. I need to reflect what's my health history. Do I have any reactions with pain meds or anesthesia? Anything I need to think about? Or, hey, these are the patients that fall in the first week when they go home. Because, hey, you told me not to submerge my wound, so I put a bag on it, and then guess what? I fell in the shower. Hey, good to know. I always love the one, too, where, hey, doc didn't say anything, said I could go back to work. Well, that's great, but I have this huge bandage on my hand now. How am I supposed to type and do my work? So ideally, you probably find another patient who's had this procedure, but the likelihood of that is very, very small. So what you can do is find that gatekeeper. Who is that person that talks to these patients postoperatively? And ask them these questions. So when you talk with patients postoperatively, what are the types of questions that you frequently get? What are the things that land them back in the clinic or the hospital after surgery? What are the things that they're surprised they weren't able to do? And what do you wish every patient having this procedure knew? The reason why this works so well is because it's not a guess or what we think will happen, because guess what? Nothing goes as planned, but rather this is a way to tap into the lived experience and knowledge of things that aren't typically shared or normally shared. And that right there is what will set you apart.